Here, we'll cover MDMA, hallucinogens, and dissociative anesthetics. And although these are all different drugs from various classes, I've grouped them because in general, people categorize these as mind-expanding or out of the body. They also tend to be called club drugs. Many people use these substances recreationally for various perceived benefits. Several of the ones we'll cover are also gaining resurgence in attention from research and medical communities. However, for our purposes, we're going to remain focused on street use in this module. Many people think of these drugs as the safe drugs or the acceptable drugs. However, all drugs carry risks. All drugs can be abused. All drugs have the capacity to disrupt people's lives and functioning. Because of the conception that these drugs aren't real drugs or don't carry the same risks, people often minimize or downplay the negative aspects. Or they don't stop to consider whether or not these drugs are a fit for them. So let's talk about ecstasy. Ecstasy, or MDMA, is considered an entactogen, meaning touch within. It's a class of psychoactive drug that produces feelings of emotional openness. Although not strictly a stimulant or hallucinogen, it has properties of both. And the experience of being on MDMA is generally called rolling. It is a controlled substance and Schedule I drug. MDMA can be swallowed, snorted, or mixed with water. Earlier, if you'll remember, I referred to the notion that drug classifications can be classist. MDMA is a good example of this. It's more often referred to as a psychedelic, even though it is also a methamphetamine derivative. The neuroscientist Dr. Carl Hart says it's usually called a psychedelic by respectable middle-class white folks because they use it and they enjoy it. Despite being able to produce hallucinations, methamphetamines are never considered a psychedelic, partially because of the views of meth and the people who use it. But back to ecstasy. So in my early 20s, I had a friend over and she had taken ecstasy, and she was overcome with how soft everything was. She laid on my living room floor and proclaimed I had the best carpet ever. I can assure you I had no such thing. I had gross, cheap apartment carpet. But being sober and observing this otherwise reasonable person proclaim her love for everything from my carpet to her own socks was deeply amusing. When people take ecstasy, they will usually feel the effects within about 20 to 30 minutes, and it will generally last around 3 to 6 hours. When we take ecstasy, it increases levels of serotonin, that neurotransmitter responsible for feelings of well-being. Feelings of euphoria are often described, as well as a sense of openness and decreases in fear or aggressiveness. Since it has stimulant properties, it also provides an increase in energy and a sense of excitement. Ecstasy often increases sexual interest, but the high levels of serotonin often diminish sex drive. And although it may distort time perception, it does not generally cause hallucinations. People are often disinhibited after taking MDMA and may become more social, more willing to dance. Many people find the effects pleasant. Since ecstasy is illegal, there's no oversight over production, thus no guarantee of what a person is ingesting. Molly, which was rumored to be 100% pure MDMA in powder form, has shown the same purity issues as traditional ecstasy. Some test samples have shown as few as 40% of the samples to contain only ecstasy. MDMA is frequently cut with other substances, which may include bath salts, other stimulants, ketamine, or even fentanyl. Thus, the risk of toxic reactions due to other additives remains a real concern. However, even for those fortunate enough to obtain pure MDMA, it's not without risks, especially as the dose increases. Ecstasy raises body temperature, and since it's often taken in hot, crowded clubs, this can have a synergistic effect. Raised body temperature can lead to problems such as dehydration and kidney failure. Higher doses, or doses with those bad contaminants, may also cause jitteriness, teeth clenching, paranoia, weakness, and even confusion. People have indeed died from hyperthermia or heat stroke. And to combat this, people began to drink excessive amounts of water. This actually led to a new problem, hyponatremia. This is caused by consuming too much water in a short term, depleting the body of necessary sodium, which can lead to headache, seizures, and in really extreme cases, death. Hyponatremia occurs with athletes as well. A study from the 2002 Boston Marathon showed that 22% of women were hyponatremic by the end of the race. Although this can happen with anyone, women are more sensitive to the hyponatremia brought on by MDMA use. So MDMA works by releasing and subsequently depleting serotonin. And our brains need time to replenish its serotonin levels, so taking MDMA frequently or taking those real high doses can lead to prolonged feelings of depression or emotional sensitivity. Very high or frequent doses of MDMA can cause neurotoxicity, in which serotonin neurons are damaged. In many cases, this is reversible, but it requires prolonged periods of abstaining from MDMA. Some people experience a pleasant mood the next day, which is sometimes called the afterglow, whereas other people experience sadness, irritability, or emotional exhaustion in the days after taking MDMA. It's typical to feel irritable, restless, easily distressed, or even antisocial in 5 to 7 days after using. And individuals with mood disorders, such as depression, may find that MDMA can exacerbate their symptoms of depression following use. And it is dangerous with alcohol, other stimulants, and MAOIs. Alcohol can increase the dehydrating effects, and any drug that raises heart rate, blood pressure, or body temperature can have a synergistic effect when combined with MDMA. Severe headache on any stimulant may be a sign of dangerously high blood pressure. MAOIs increase our supply of serotonin, so when taken with MDMA, it can increase the likelihood of serotonin syndrome. Serotonin syndrome is potentially fatal, and symptoms often include muscle rigidity, diarrhea, or shivering. Life-threatening signs are seizure, irregular heartbeat, or unconsciousness. Another way to keep people safe is to test for contaminants. There is very little pure MDMA out there, and contaminants can cause toxic reactions such as agitation, paranoia, hallucinations, illness, or overdose, especially in the cases of fentanyl being added to it. DanceSafe.org is a trusted site to obtain test kits, and there is a link to them in your resource packet. The third way we can help keep our clients safe is to hydrate and consume sodium. Since MDMA increases core body temperature, overheating is a serious risk. And this risk is compounded by being in a hot environment, taking a large dose, or mixing with other temperature-raising drugs like cocaine or amphetamine, and or just lots of physical exertion while using. Ideally, people hydrate well even before taking MDMA, but remaining hydrated is important. However, the feeling of being dehydrated due to dry mouth and high body temperature can lead people to drink way too much water, which can cause that hyponatremia we talked about. So, electrolyte powders and salty snacks can help prevent hydration-related illness. The fourth way people can stay safe is to take breaks. Overexertion on MDMA can be common, so taking breaks to rest and cool down is important. Removing any kind of headwear, such as hats or bandanas, can help people cool down more effectively. And finally, space use at 3 to 6 month intervals. To minimize the risks of MDMA, usage should be spaced by a minimum of 3 to 6 months, and individuals are encouraged to not increase their dose if their lower dose is actually still working for them. At a bare minimum, people should wait a few weeks before taking MDMA, as serotonin needs time to replenish. It's natural to develop a tolerance over many years of rolling, but it should happen slowly, should be a gradual need. Needing to take more and more MDMA over the course of just a few sessions is often an indicator that someone is not putting enough space between their use. MDMA doesn't tend to cause physical dependence, but if it's taken too frequently, MDMA can stop working or cause disruptions to mood. So at this time, we're going to pause. In our next segment, we'll begin our trip with hallucinogens.